current system is failing too many people. Look, the problem is because mammography is often painful and unpleasant and takes a long time to get back the answers, the acceptance rate of women getting breast cancer mammography screenings is under 50%. We need to find a better way of doing imaging of the breast. We're seeing more and more breast cancer rates. It's increasing in younger people and increasing slowly in the elderly group. When you put your needle into a cancer, it's gritty, it's hard. When you put the needle into a fatty area or a cyst, it goes right through, it's soft. So this is now quantitative measurements of imaging for breast cancer. Toxic exposure, increased cancer risk, and also parasites lead to chronic inflammation, which gives you increased cancer risk too. Increasing age is generally an accepted risk factor, except we're now seeing more women in their early 20s developing cancer. Also importantly, remember men are at risk. 1% of men get male breast cancer. And if you're a firefighter or exposed to toxins or radioactivity, your male breast cancer rate is 2%. Tobacco, smoking, and alcohol consumption. Cut down on these and exercise more. Eat a low-fat diet with omega-3 oils. Walking, cycling, sports, and other exercises strengthens your immune system, which helps the body to keep cancer reduced, because the body cells are always making cancer cells and always killing them. The role of 3D imaging is important because you see it better, and once you find it, you can target it better for the biopsy. And also it's a better way to follow treatment because we're using all the technologies such as thermography, elastography, 3D blood flow imaging to decide how the treatment is working. The American Breast Cancer Foundation is focusing on better diagnostics and safer diagnostics with less radiation than standard mammography. So now we're looking at CT or CAT scan imaging with lower radiation levels or radiation exposure comparable to the routine mammogram, but offer 3D options that avoid compression of the breast and are quicker, some as quick as seconds. Breast Cancer Foundation is also supporting the use of image-guided treatments, thermography, the use of elastography, and introducing it, because right now thermography, which is widely used, you can tell the difference between a red area on the breast, which could be psoriasis or rosacea or lupus, versus a inflammatory breast cancer. This is important because inflammatory breast cancer is missed by mammography routinely. It doesn't see it because it starts in the lymphatics of the skin, so it's basically a highly aggressive cancer starting in the skin of the breast, and it does not show up on mammography. So there are better ways, and the American Breast Cancer Foundation is adopting and supporting the better ways to detect inflammatory breast cancer.
Thank you, Dr. Bard, for participating in this event. It was exciting to have you, and we were very, very blessed.